When it comes to the human body, few topics inspire as much curiosity, confusion, and sometimes anxiety as the natural variation of our most private parts. Among these, a common question that often arises, whispered between friends or typed anxiously into search engines, is whether your vagina can truly change color. Is this something to worry about? Is it a sign of health or disease? Or is it simply another example of the body's amazing ability to change and adapt throughout life? Let's dive deep into the facts, the myths, and the science behind this fascinating question. First, it's important to clarify terminology. The term vagina is often used to refer to the entire female genital area, but medically speaking, the vagina is the internal canal leading from the external genitals to the cervix. The external structures, including the labia majora, labia minora, clitoris, and surrounding skin, are collectively called the vulva. When people talk about color changes, they're usually referring to the vulva, particularly the labia. So, can the vulva, or what is commonly called the vagina, really change color? The simple answer is yes, and in most cases, it's completely normal. The color of the vulva can range widely among individuals, and even within the same person, it can change over time or due to various factors. Let's explore why. One of the main reasons for color variation is genetics. Just as people have different skin tones, eye colors, and hair colors, the appearance of the vulva is highly individual. Some people have pinker tones, others may appear more brown, purple, or reddish. These differences are normal, and there is no right or wrong color. Beyond genetics, hormonal changes play a significant role. During puberty, the body undergoes a surge in hormones, particularly estrogen, which can cause the labia and surrounding skin to darken. This is a normal part of development. In fact, it's one of the many signs that puberty is underway. The increased blood flow and hormonal influence lead to a richer, sometimes deeper coloration. Pregnancy is another time when color changes are common. The surge in hormones, particularly estrogen and progesterone, increases blood flow to the pelvic region. This can cause the vulva, and even the vaginal walls, to appear darker or more purple. This phenomenon is so well documented in medicine that it has a name: Chadwick's sign. It's one of the earliest signs doctors look for during a pregnancy exam. The color usually returns to its previous shade after pregnancy, although some people may notice a lasting difference. Menstrual cycles can also cause temporary color changes. Just before or during a period, hormonal fluctuations and increased blood flow may make the vulva appear darker or more flushed. After the cycle, the color typically returns to baseline. Another factor is sexual arousal. When someone is aroused, blood rushes to the pelvic area, causing the vulva and clitoris to swell and darken. This is a completely normal physiological response and usually subsides after arousal passes. As people age, the vulva can also change color. With menopause, the decrease in estrogen can cause the skin to become thinner and paler, sometimes with a more grayish or whitish appearance. This is a natural part of aging. Much like the development of wrinkles or changes in hair color, there are also external factors that can influence color. Friction from tight clothing, vigorous sexual activity, or sports can sometimes cause temporary redness or darkening. Shaving or waxing can sometimes lead to irritation, which may make the skin appear redder or darker temporarily. But what about medical concerns? While most color changes are entirely benign, there are situations where a change in color could indicate a problem. If you notice sudden, persistent, or extreme changes in color, especially if accompanied by pain, itching, swelling, sores, or unusual discharge, it's important to consult a healthcare provider. Infections, allergic reactions, and, in rare cases, cancers can cause discoloration. Certain sexually transmitted infections, such as herpes or syphilis, may cause sores or color changes. Lichen sclerosis, a rare skin condition, can cause white patches or thinning of the vulvar skin. Pigmented lesions or moles should also be checked by a doctor to rule out melanoma, a rare but serious form of skin cancer. There are also some myths and misconceptions about vaginal color changes that need debunking. A common myth is that sexual activity, especially frequent sex or sex with multiple partners, will cause the vagina or vulva to become darker or looser. This is not true. The color of the vulva is not an indicator of sexual activity. The vagina is a muscular canal that is designed to stretch and return to its normal shape, much like a rubber band. It does not become permanently looser or change color based on sexual frequency. Color changes are much more about hormones, genetics, and normal physiological responses than about sexual history. Another misconception is that certain products or treatments, such as creams, soaps, or lightening agents, are necessary to maintain or restore a certain color. In reality, the vulva is self-regulating, and the use of harsh chemicals or unnecessary products can actually harm the delicate skin, leading to irritation, allergic reactions, or even long-term discoloration. The best approach is to gently cleanse with water and avoid scented products or harsh soaps. Cultural and societal pressures can also play a role in how people view their bodies. The rise of airbrushed images in media and adult entertainment has led to unrealistic expectations about what is normal. In reality, there is a wide range of healthy, normal variation in the appearance of the vulva. Just as faces, hands, and other body parts come in all shapes, sizes, and colors, so too does the vulva. There is no one ideal look, and all variations are natural. It's also important to understand that the natural pigment of the skin, called melanin, affects coloration. People with darker skin tones often have darker labia and vulvas, just as they have more melanin in the skin elsewhere on their bodies. This is entirely normal and healthy. Let's not forget about lifestyle factors. Smoking, for example, can decrease blood flow and oxygen to tissues, sometimes resulting in a darker or more uneven skin tone, including on the vulva. On the other hand, maintaining a healthy lifestyle with regular exercise and a balanced diet supports healthy circulation and skin health. In summary, the color of your vulva can and does change, and in most cases, it's nothing to worry about. These changes are usually due to hormonal fluctuations, genetics, age, arousal, pregnancy, or other completely normal physiological processes. There is a wide range of healthy variation in color, and what's normal for one person may not be normal for another. If you do notice abrupt, persistent, or concerning changes in color, especially if accompanied by other symptoms, it's worth checking in with a healthcare provider for peace of mind. Ultimately, embracing the natural diversity of the human body is one of the most empowering things you can do. The next time you wonder whether your vagina, or more accurately, your vulva, can change color, remember, yes, it can. And it's almost always a sign of your body's natural, ever-changing rhythms. There is no need for shame, worry, or unnecessary products. Your body is unique, beautiful, and wonderfully normal, just the way it is.